Welcome to Simulation Scenario Development 101. Simulation provides a safe environment for nursing students to practice knowledge, skills, and attitudes in a realistic clinical situation. Hello, my name is Nancy Wolfe. The purpose of this video is to provide the learner with basic information needed to create a simulation scenario. At the completion of this video, the learner will be able to explain teaching strategies for simulation in nursing education, identify key elements of a simulation scenario, describe the characteristics of debriefing, and design a simulation scenario. An integrated review of literature from the past 5 years using CINAHL and PubMed databases identified research studies that successfully implemented simulation into nursing education curriculum. The effective simulation teaching strategies include faculty and student preparation. Pre-simulation student assignments include reading, written work, and worksheets to enhance learning. Establish scenario guidelines with learning objectives related to theory and curriculum threads and student learning objectives, including psychomotor and cognitive competencies. Incorporate methods to appeal to different learning styles, team interaction, and cooperative learning. Here's your opportunity to think out of the box. Promote scenario realism. Create an authentic environment. The scenario should apply to a realistic situation and link directly to theory or the course of study. Post-simulation journaling and debriefing with open-ended questions, guided reflection, and feedback focuses on the key points. Debriefing sessions usually last 1.5 to 2 times the length of the scenario. Evaluate with a rubric which includes criteria for expectations. Name the scenario and estimate the scenario time as well as the debriefing time. Usually the debriefing session is 1.5 to 2 times the length of the scenario. Identify the target group of learners by course and student level. Identify the simulation level, such as high fidelity, moderate fidelity, or static mannequins, live patient actors, or video clips. Compose SMART objectives related to theory, curriculum threads, and student learning objectives. List cognitive and psychomotor skills needed prior to participation in the scenario. A description of the scenario includes patient demographics, past medical history, signs and symptoms, current medication lists, allergies, significant others, and social and mental health history. List all the equipment and props necessary to achieve a realistic simulation. List the number of participants needed for the activity and define the student roles for actors and observers. Write a script for Confederate actors. Setting the scene also includes a list of resources for the participants' pre-simulation assignments. Develop a rubric to evaluate whether expectations were met, not met, or exceeded. Once you have identified all the key elements of a simulation, place the information in the storyboard. This will guide the flow of the scenario. Debriefing includes reaction, analysis, and summary phases. The reaction phase allows participants to express feelings. The analysis phase examines what occurred. This is a period to clarify thinking and correct misunderstandings. This activity is learner-centered. Listen. Use a non-judgmental approach. Use debriefing for reflection and self-assessment. Focus on the learning, not the performance. Ask questions to augment critical thinking. This is a time for participants to share observations. The summary phase reviews key points and develops action plans to apply knowledge to the clinical setting. Here is an example of a scenario template. Keep it simple. Establish SMART objectives. Here is an example of a storyboard template. This will guide the flow of the scenario. Establish an endpoint. Either the objectives are met or the time has expired. These web links offer additional information on simulation. Here is a list of my references. Thank you for listening. For further information, please contact me at nancyjanewolf@gmail.com.